My name is Jason Snibbe. I'm an orthopedic surgeon in Los Angeles. I'm going to talk about leg edema after total joint arthroplasty. I have a busy, I do a lot of total hips and total knees, and I do a lot of hip arthroscopy. So I think one of the things I always talk about in these lectures about the gecko is that this is kind of something that we never talk about, like swelling, right? But how many times do you, your PA, your medical assistant get that call at like 5 days, 6 days after surgery? My leg is massive. I'm on my way to the urgent care. I'm on my way to the emergency room. I called my brother who's a doctor. He's really concerned about me. He thinks something's wrong. I might have an infection. People are just freaking out. And probably if you measured the actual cost to the healthcare system for this one thing, lower extremity edema, it's probably in the billions, because it's how many phone calls and emergency room visits, unnecessary testing, some ER physician putting a needle in a brand fresh new total knee. All these things happen to us all the time, but it's not really discussed a lot in the recovery. And when you think about edema, what do we have, right? What do we have? It's about four things, right? You have compression stockings. You have an ice machine that you provide to the patient. Maybe you give them a game ready that has compression. You have elevation, right? You have maybe, and that's about it. Maybe elevation and then SCDs. Some people like to use SCDs in the hospital. Some people send their patient home with SCDs, right? But those can be cumbersome, difficult, and there's also, all these issues with, the tubing and the battery power and all this kind of stuff. So what happened to me, my story is that I was the guy who does all my DME work came up to me and said, literally at the end of the day, says, listen, this company is kind of interesting. They have this new device. It looks like a wristwatch. You stick it on your leg. It stimulates the perineal nerve. It stimulates the muscles in the anterior compartment of the lower leg and the deep compartment. And it basically increases venous return. It's for lower extremity swelling. So to me, it was a genius idea. And I took a step back and I said, why didn't I think of this? It's an amazing device because it's so easy, it's so simple, it's so easy to use, and it's extremely low profile. You can wear it, you can walk around with it, you can put it underneath your jeans, underneath your pants, and it helps the swelling. It helps the swelling in the lower extremity. And so I started using it. And so I've now used it on, I'm probably close to 1,000 patients now, as far as in the last couple of years. And we're trying to figure out, part of this whole project is trying to figure out a great way to study it, to understand how to get a team together and say, how do we measure swelling? But I think that it's important that we talk about it because, and what I see, and a lot of it's obviously anecdotal information, but especially my total knees, which I think were the most difficult patients with swelling, come back at that 2-week mark, and we're not getting the calls that we used to get. We're not getting all this, and their legs are very similar to their non-operative leg. I mean, very little swelling, very little edema. I'm not seeing weeping wounds. I'm not seeing people with these massive, huge legs that I would normally see. And the other part is the patients like it. It's an easy thing to use. They enjoy the fact that it stimulates the nerve, and they like using it. So I think it's been very beneficial to me to use it in my practice. So, these are all the data. There was a study done on the Bone Smart website talking about dealing with edema, and 75%, that last line, 75% of total knee patients with edema have difficulty bending their knee. So how does that truly affect the way our outcomes, how we can move our leg, how the range of motion in your total knees after surgery? Emergency room visits, we talked about this. This is a huge thing. My leg is swollen, I'm on my way to the ED. They get a Doppler, they get a blood test, they get a wound check. This costs money. It costs money to the system. So this is the beauty of the device. And like I was telling you, you put it. What's great about this device is that you have. If you look at the device on the on the bottom, there's a little line there with a dot around. That line is where it goes right on the fibular head, and basically it stimulates the nerve. It has a disposable battery. It stimulates the nerve. You have to be careful because if you turn it on and it's on and you try to take it off, it will shock you if you grab it. So sometimes the husbands or wives or caregivers will get shocked by it sometimes, but that doesn't cause any problem, but just funny feeling. But it's disposable. It lasts 24 hours. The way I prescribe it to my patients, I give them a pack. They come 2 in a pack. I give them 5 packs. So that lasts 5 days. And I make them use it on the extremity. If I do bilateral total knees or bilateral total hips, and the insurance doesn't, we'll talk about insurance and costs and stuff like that, but they'll have to buy 2 packs typically, so they go 10 days on both legs for bilaterals. And I use it on every lower extremity patient. Knee scopes, ankle surgeries, Achilles, ACLs, total knees, partial total knees, and all my hip surgery, hip arthroscopy, gluteus medius work, total hips, revision total hips. That's what it looks like, and it has a gel on there, and we'll talk about some of the studies that have been done. And basically, the way you think about it is like, what's the best way to get rid of edema is walking, right? So what the gecko can do is it can simulate walking about 60% of walking. So 100, if you walk, that's 100%. The gecko can simulate 60% of that muscle contraction that you would do normally with walking by just putting it on. And so you can actually turn it on. So you have them. I encourage you to put them on, and you actually wear them around. You can actually walk around with them. So my patients usually don't wear them to sleep. Some of them wear them to sleep. You can turn them on. They have 11 levels. So and to turn it off, you press the negative sign for 3 seconds. But you turn it up, and the number of flashes of the light indicates what level you're at, right? So let's say you're on level 5. It will flash 5 times. You can put it on. You can walk around. You can put ice over it. I use a waterproof Mepilex dressing on my total knees, so they just literally lay it right on top of that, and it's very easy to use. And then at nighttime, they turn it off and they throw it. They've been using it all day. The battery runs out. You throw it away, and they use one every day. There's also a lot of research showing, and this is from England, basically showing microcirculation. So as you're pumping all of that venous blood out of the leg, guess what? The arterial supply to your wound and to your lower extremity increases. So you're getting an increase in microcirculation in the skin and the tissues because of this device, because you're getting all that venous blood out of the leg. And so when you compare it to sequentials, it's 30% better than sequentials in increasing venous return. And you know, in my world, before, what my patients would typically get in my hospital, and we can talk about this, we have an open forum about it, is that my patient would get a TED hose stocking. They get sequentials in the hospital, but the minute they went home, they got nothing. They had the TED hose. And again, I got 1 million calls about the TED hose because they're like, you know, my 75-year-old husband can't put my TED hose on because his hands are arthritic. He can't put them on his leg. I mean, I always tell patients, my wife, I remember with our first baby, she was pregnant, we went to Europe, and the OB said, put TED hose on her. I mean, it was like, I was like wrestling her to try and get these TED hose on her leg on the airplane. And I thought, how the hell do my patients do this? You know, like, this is crazy. So really, there's really nothing else besides the sequentials and the TED hose, and the TED hose are impossible. So I don't do TED hose anymore. I just use the gecko. I never put any type of compression stocking on my patients. And then we talk about venous return. This is the study showing increased venous return with the gecko device. This talks about microcirculation, improved microcirculation based on this fluximetry data. And then, you know, again, this just talks about increased blood flow compared to sequentials, the venous return, and also the arterial supply to the lower extremity is increased significantly with the gecko device. And again, it talks about, you know, the venous blood velocity is increased with the gecko device compared to others. this talks about compression stockings. So when you compare the gecko device to compression stockings, which probably many of you in the room still use, which is commonly used, this basically shows that as that line goes up higher, there's a greater difference between the greater decrease of swelling in the leg. So if there's a 2 centimeter decrease swelling in the leg, that's a higher number. So that's it. So the gecko improves the decrease in swelling in the leg. And then comfort, patient comfort. It's easy to use. So what are the problems with this device? So the problem with the device, and we'll talk about a couple things. Problem with the device is that there's a few people, I've had a couple, probably 2 patients that have a hypersensitivity to the gel on the thing. So they put it on, their leg gets red, right? Some people just deal with it. Some people said, I can't use it. The other problem I had is in hip arthroscopy, young, thin women, their perineal nerve is very, very close to the skin. So when they put this device on and they turn it on level 1, their nerve is firing like crazy. It's intense. So those young women can't use, I've had a couple young women that couldn't use it. Sometimes people, the nerve, when you're extended, when your knee is extended, the nerve sometimes it moves a little bit, it tucks back behind the fibular head. So sometimes we tell patients when their knee is fully extended, it doesn't work as well when your knee is slightly bent, like maybe 20, 30 degrees of flexion, the nerve will get more relaxed, right? So sometimes we tell patients that if their knee is extended, it won't fire as much as when it's bent. Or if their knee is extended for a period of time and they're on level 5, if they bend their knee, the 5 will be too much and they have to turn it down. It's being used by the military and special operations groups. It's being used by many of the professional teams and probably in some of your towns. So it has a very broad application, and it's been used by millions of people because it's so easy to use and so simple. So it's portable, it's lightweight, it's proven to be better than sequentials. It's easy, it lasts a day. You know, you put it on for a day, you take it off, you throw it away. You can lay ice on top of it. It's very, very comfortable. I encourage every one of you to put it on and try it and play with it and see how you like it. It's very easy to use, and I've been very, very happy and excited. And I think that as we continue to use it, there's a lot more applications for it. And I think also we're talking about joint replacement here. I mean, many of you do stills like trauma call. You take care of ankle fractures, pylon fractures. I mean, there's an enormous amount of work that can be done with this device. And in England, they did a study looking at ankle fractures that were very swollen. And when they put the gecko device on patients, they were able to take the patients to surgery 3 days earlier because of the device, because it lowered their swelling significantly. So thank you.